Welcome back to Africa 54. Our Linord Moudou joins us now with the latest health news. Welcome, Linord.
Hello, Vincent. Hello, everyone. Well, the World Health Organization has approved a device that enables non-surgical circumcision for adult men. The device Prepex consists of a couple of plastic parts and a rubber band. It essentially cuts off the flow of blood to the foreskin, causing the tissue to die and fall off. The procedure uses only topical anesthesia and is safer than surgery. Research shows that circumcision is effective in limiting the spread of AIDS and other venereal diseases. And Africans living in the United States still confront some major barriers to health care. Some of the challenges include language, lack of health insurance, and navigating the complex U.S. health system. There are also traditional and cultural conceptions about health, mental illness, and diseases like HIV/AIDS. The results, well, many patients go undiagnosed and untreated for their illness. For more on the issue, we are joined by Vienna Mbagaya, an epidemiologist in Washington, D.C., and executive director of Vienna Nairobi, a public health consulting firm that focuses on global health, health disparities, and women's health. Ms. Mbagaya, welcome to the show.
Thank you. Thank you for having me.
First of all, obviously, it is a very important issue when it comes to the immigrants' health, the African immigrant health. Why is it so critical to address it in a specific way?
Well, our culture is one that is a conservative culture. So we have different ways through which we receive messages that are communicated to us. We may feel a disconnect to the American culture or the Western practices and not really connect to the messages that are sent to us. So it's a call to health organizations and the research community to find out, to study the culture and to study the immigrant population and see what are the ways through which they can create specific and effective messages.
So when we look at, you talked about the fact that in general, perhaps for the most part, the African culture is conservative. So does that tie into the issue of sexual health and the way it's being addressed and perhaps not even being addressed when we look at the issue of HIV/AIDS, for example?
Definitely, definitely so. With a conservative culture, you don't have room to talk openly about sex or sexuality or sexually transmitted infections or HIV status. You'll find that a lot of people will look at it and deem it as a taboo topic. So that in itself is a barrier, and it impedes public health messages from reaching the targeted audience.
So when we look at HIV/AIDS and the prevention and the issue of stigma even among the African and refugee population, how do you think that is really affecting the perhaps prevention possibilities?
As I said before, there's some messages that may be sent to the Black community in the U.S., and Africans, although they're considered Black in the U.S., they may not identify with the messages that are being sent. They're not being specific. So when you look at sexual health messages and HIV/AIDS messages, we have to find a way through which we can communicate them in a way that circumvents the stigma that is attached to both.
So what are some of the evidence-based data, if any at all, that show a correlation perhaps between addressing social stigma and the improvement of sexual health and HIV prevention?
Well, you'll find that there is little research. It's a little limited, so we don't have that much. But in my experience working in military health, I've seen how the Department of Defense and the Veteran Affairs have invested a lot of energy and a lot of time and a lot of funding in anti-stigma messages towards service members who might feel the stigma of pursuing or seeking help, psychological health help. So we have evidence, we have models that work. We have models that work and that can be applied in this context where we're using the same anti-stigma models or programs that exist and borrowing from them and applying them to the African immigrant and refugee population here in the U.S.
So it's obviously something that is clearly very important to you, an issue that is dear to your heart.
Oh, definitely. Full disclosure, I am African, and I am an African immigrant. I was born and raised in Kenya, so I do have a special interest in this. And I look at Vienna Nairobi, the practice, as a means through which, a platform for me and my colleagues who are talented and passionate about public health. We look at it as a way through which we can use our careers to serve. And for me, it's not just to serve my community here in the U.S., but my community, the community that raised me back in Africa.
And we wish you all the best, Vienna Mbagaya.
Thank you so much.
Thank you so much for being with us. And that was Vienna Mbagaya with Vienna Nairobi. That's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.